Hi, you guys. Welcome back for our daily practice questions. As always, I like to first get into my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I'm Dr. Brittany Weinstock. I am a family nurse practitioner, and I am the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer reminders that there's no absolutes in medicine. We treat on a patient by patient basis, so any of the questions that you see here have been designed and created based on the current guidelines being tested on the ANCC as well as AAMP exam. Now, any of the videos that you may see that I may be teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. Question number one states a patient has been diagnosed with uncomplicated gonorrhea and chlamydia has not been excluded. What is the best treatment option? Is it A, ceftriaxone 500 milligrams IM, B, azithromycin 2 grams PO, C, doxycycline 100 milligrams BID for 7 days, or D, gentamicin 240 milligrams IM? All right, so I always recommend reading the stem of the question first as it allows you to slow down to ensure you're answering what's being asked of you. So the stem here states, what is the best treatment option? So when they're asking for a treatment, you need to look back at what the diagnosis is. So either they're going to provide you with the diagnosis or you're going to have to take it a step further and look at the assessment findings so you're able to determine what the diagnosis is so then you are able to treat it. So this patient has come in, they've been diagnosed with uncomplicated gonorrhea, but chlamydia has not been excluded. So these are two factors that you need to consider when you're providing treatment. So the best answer choice here is C, doxycycline 100 milligrams BID for 7 days, as chlamydia has not been excluded, so you want to co-treat with both of those. So the doxy will cover the gonorrhea as well as chlamydia. Question number two, a patient with uncomplicated gonorrhea has a cephalosporin allergy. What is the best treatment at this time? Is it A, ceftriaxone 500 milligrams IM, B, azithromycin 2 grams PO, C, doxycycline 100 milligrams BID for 7 days, or D, gentamicin 240 milligrams IM plus azithromycin 2 grams PO daily? Take a moment to go chat. All right, so if that patient has gonorrhea with a cephalosporin allergy, typically if it's uncomplicated gonorrhea, we go directly to our ceftriaxone 500 milligrams IM. If they have a cephalosporin allergy, you want to give a one-time dose of the gentamicin, 240 milligrams IM, plus a one-time dose of the azithromycin, 2 grams PO. Not daily, just one-time dose. So D is your best answer. And then lastly, question number three, the nurse practitioner is treating the current patient with uncomplicated gonorrhea with the gentamicin and azithromycin, but chlamydia has not been excluded. How should the nurse practitioner treat? And I'll read that one more time. So the nurse practitioner is treating the current patient with uncomplicated gonorrhea with the gentamicin and azithromycin, but chlamydia has not been excluded. How should the nurse practitioner treat? Is it A, ceftriaxone 500 milligrams IM, B, Doxy, 100 milligrams BID for 7 days, C, Bactrim, or D, no additional treatment is warranted? Take a moment to what you got. All right, so here the stem of the question states, how should the nurse practitioner treat? So in this situation, the nurse practitioner is treating this patient with gentamicin and azithromycin. So this person has uncomplicated gonorrhea, and we're planning to treat with gentamicin and azithromycin, but chlamydia has not been excluded. So here, no additional treatment is warranted. Remember, you can also treat chlamydia with azithromycin. Doxycycline now trumps azithromycin, but they're both first-line therapy options, but doxy is the immediate first line. Um, so when we are co-treating, we want to go with doxy for the management. But in the event that this patient has a cephalosporin allergy and you had to provide treatment with gentamicin plus azithromycin, then you don't need to add an additional medication such as doxy to cover the treatment of chlamydia because the azithromycin should cover it. So your best answer here again is D, no additional treatment. So let's just walk through that again one time. So if you have somebody who has uncomplicated gonorrhea, we treat with a one-time dose of ceftriaxone, aka Rocephin, right? Now, if chlamydia has not been excluded, then you want to go with doxy to co-treat these two. If the person with uncomplicated gonorrhea is allergic to cephalosporins, then you want to do a combination of the gentamicin and azithromycin. So if you are having to treat it with gentamicin and azithromycin and chlamydia hasn't been excluded, then you don't need to add anything additional. So think of that full algorithm, and I can post a chart so you can see what I'm saying to help you go through the flow. But again, remember, if it has not been excluded, we co-treat with doxy. If they are planning to treat with the combination of azithromycin, then you don't need to add anything additional for co-treatment. All right, you guys, I hope you found this helpful. As always, be sure to like, comment, subscribe, and share with whomever you may think may find this beneficial as well. But y'all make sure to meet me back here. If you need any of the resources that I offer, feel free to reach out to the nursing studio by giving us a call at 803 400 6864. You can also shoot a text message to this number or shoot us an email to the nursing studio, the number one at gmail.com. The things that I do offer are my review book that is provided in an ebook option or the paperback option. They're both linked in the bio of this channel. If you are someone who prefers to review independently, I do offer a self-paced review for family and adult general designed for both the ANCC as well as AANP exam. That's also linked in the bio of this channel. I still have one remaining slot for our upcoming 5-week review that is starting Monday, September the 9th. And then the QBank options are also linked in the bio. And you know, I always say if you're looking to get or book a one-on-one session, that you need to reach out to the nursing studio by giving us a call or shooting us the email, as these are customized per person. So as always, y'all make sure y'all meet me back here. Happy studying. Bye, y'all.